joined today by Melisa McNeil. She's the director of the EMS program at Western Carolina University. Melisa, thank you so much for agreeing to give us a bit of your time today. I really appreciate it.
Yeah, no worries. This will be fun.
Terrific. So Melisa, if you could you tell me a little bit about sort of your educational background and your career history, sort of what led you to your current role?
Actually, kind of funny, I randomly chose EMS. I had originally majored as a business law and political science major and realized that that is not where my passion was at. So I took some time off from school and kind of randomly fell into it, fell in love, and I've been in EMS ever since.
Where did you get your training academically?
So my initial degree was an associate's degree at the local community college, Southwestern Community College. It's right around the corner from me. After I completed the degree, I moved to Florida and went to work for a year or two, and then decided I would like to further my education. Did not know that a bachelor's degree existed in EMS. When we moved back from Florida to North Carolina, I found the EMC program here at Western Carolina University and became a graduate in 2005. So
not that long ago for those of us who graduated many years earlier. Really appreciate that. What's been sort of your primary focus or practice as an educator?
Just classroom speaking, my big focus is pharmacology. That's one of my favorite topics, and it's not the favorite topic of most folks in my area. So I really enjoy teaching pharmacology. I also teach the advanced patient assessment course here at Western, where we go through the head to toe pathophysiology, disease physiology on top of them.
Could you tell me a little bit about your program at Western? Is there a sort of an underlying conceptual framework? And then, what are the different tracks, or how is the program structured?
So the program here at Western, there are actually two programs. There's a distance learning program and the residential program, which I am the director of. The distance learning program is truly set aside for folks who have completed an associate's or a continuing education program, who have their paramedic currently working in the field, adults who have other commitments who can't come to campus. The residential program, on the other hand, is intended for students who are more of the traditional student, who have left high school, have come to college, they complete their first year to 2 years of liberal studies and prerequisites, and then come into the program. Some of them will have a little bit of background. Maybe they've done some volunteer work, or they've done firefighting, or they've taken an EMT program at their local community college. Every now and then we get a transfer paramedic who wants to come back and get a bachelor's degree. But they come into the program in their junior year. They spend 2 years with us and complete the entire paramedic curriculum. We do have 2 tracks, or we call them concentrations. The first one is science, and that's really intended for folks who want to further their career as a provider. Maybe they want to go back and get a nursing degree, or go to PA school, med school, DO. I've got one in dental, one in veterinarian. So, they want to go graduate in the provider area. The other track is the health management, and that's for folks who really intend to climb the EMS career ladder and be administrators and supervisors and training officers, those kinds of things. But it's funny how some folks will complete the management track and end up climbing in the provider arena, and some folks will complete the science track and end up in administration. So there's quite a bit of overlap.
Well, that's really very interesting. I'd be interested in knowing how you first learned about ReelDx.
Actually, completely by accident. A couple of the faculty were working on redeveloping some courses for the online program, and we wanted to bring more of that kind of scenario-based education, that authentic problem to the online environment. Online courses have really kind of expanded an online program. So we just wanted to enhance it a little bit. And some of the faculty, they were developing a pediatric course, which is really funny with Dr. Spiro's background. They ran across ReelDx online, found the free access videos, had integrated some of those into the course and into the syllabus, and then they stopped working.
Oh dear. What happened?
Well, I think that some of the content was moved from the free view over into the pay for view. So we got in touch with ReelDx and kind of found out more about what the intent was and what you guys were doing and building and creating, and said, we're on board.
Well, we are thrilled that you are on board. I wonder if you could tell us a little bit about how your program is using ReelDx in the curriculum. What are some of the example use cases? How are the faculty incorporating the cases into the curriculum?
So actually, there's lots of different ways that folks are using them. In the distance learning program, it's more of a discussion type activity. I see that the most often, where cases will be linked into the course. Students are expected to go and review them and then post, their discussions for everybody to kind of build around. Later in the course, they will actually get, say, the diagnosis or the treatment options. We'll actually open up those other drawers now, which is so fun that those drawers open and close, which they didn't previously. I really love that, by the way. In terms of the residential program, we use them in several ways. Sometimes we'll have students do case studies on their own at home and bring them in. We've incorporated them into examinations, which is really fun. Well, at least on our end, sometimes the students don't particularly think so. We've incorporated them into our simulation lab. So we'll actually start with, here's your patient clip with the ReelDx piece, let them watch that portion, and then don't open any of the drawers and let them run the actual scenario. And then wrap it up with a debriefing with all of the information that's in the drawers, the differential, the actual outcome, the treatments. So yeah, we actually use it in quite a few ways.
Wow, your program has really been very innovative in that way. I wonder if you could tell us a little bit about your path to adoption. Was there a focused effort around incorporating the cases in a variety of different ways, or has it been more organic in terms of having each educator find different ways to incorporate it into courses?
Well, initially, we really adopted to make that one particular course work, where the faculty had been redesigning that course and then ran into the videos are gone. We need the videos back. But since adopting, it's such a great tool. It's really, the idea has been in faculty meetings, okay, now that we have this tool, what can we do with it? How can we use it and get the most out of it, not only for us as educators, but for the students as well. So it's really been fairly organic and kind of flowed.
Terrific. What kind of feedback are you getting from students and from your faculty? Has there been any evidence about how it's impacting conceptual understanding or other performance?
Yes, particularly with the campus program. I mean, we get lots of emails from distance learners saying how much they enjoy the product, and now that they're hooked. But for the campus students who aren't working paramedics, who are just starting, say, clinical rotations, and maybe they haven't seen an infant with croup, or they haven't seen a nystagmus, they haven't done an extraocular eye exam. Having that available in ReelDx to show them, this is what this infant with this disease process is going to present like. This is what they're going to sound like. Here is a true allergic reaction. Listen to the audible wheezing from across the room. What do you see in the video? Just in the video itself within the first 10 seconds. It has really given them the opportunity to see some of those unusual pieces that you may not see as a practicing, pre-hospital provider for many years. So they're really enjoying it. We get lots of positive feedback.
Well, that's really great for us to hear. We're so glad that, your program has been, such an early adopter of the technology and has been continued to sort of lead the way for other programs. I wonder if, my hope is to show this video for folks who are considering ReelDx for their program. I wonder if you have any thoughts or advice that you could offer to them around how to best incorporate it into your program, any best practices that you've learned that maybe will help people overcome hurdles in the future.
So my first piece of advice would be to have an open mind about how you can use it. Don't get stuck in one place with it. We saw that initially when we started. We wanted the students to watch the videos, and then that was kind of it. Now that they've watched the video, the now what was the next big question. So don't feel stuck with one usage. I would say that one of the things that has really worked out the best in terms of Western's usage of ReelDx cases is that kind of discussion and case study with the students. And if you want to do that in a simulation laboratory, that's fine as well. But something where they actually get to see a part of the case and then get them into that thinking process of, okay, what do you think is going on? Why do you think that? What signs and symptoms did you see in the patient to support your field diagnosis or your other differentials? What would you treat them with and why? Tie it back to that why to get them really kind of thinking about what's going on.
Well, Melissa, that's really fantastic advice for people who are considering ReelDx, and I just want to take a moment to again say thank you for giving us a little bit of your time today. And we do appreciate your ongoing use of ReelDx and look forward to many more innovations from your program.
Oh, thank you very much. It was a pleasure.
Thank you.